Ladies and gentlemen, please welcome to the stage foreign policy publisher and CEO, Andrew Solinger.
Hello, everyone. Thank you. We've all had very long days, I know, in bilateral meetings and other events, but let's just make sure we're refreshed for this discussion. Hello, everyone. How are you this evening? Great. We're here to discuss a very important topic, and one that I'm going to personalize for you right now, diagnostics beyond 2030. What a lesson we all learned with the pandemic a few years ago in diagnostics. And I will tell you, the personal story is that I thought I wasn't going to be able to come and join you today because my wife Susie was horribly sick this weekend, and we thought for sure that she had picked up one of the new strains going around. But we have good diagnostics at home right now. So we were able to test thoroughly, repeatedly. She's perfectly healthy now. I didn't catch anything. I never went down. I'm perfectly healthy. I had to sleep in my son's bed for a few nights. But other than that, all good. And that is something that we should take away from that lesson, how important and vital that is. It took this calamity for us to get those kinds of tools into our homes and our hands. And I think there's a lot of we could take away from that and learn today. Diagnostics was further underscored, the importance of diagnostics, further underscored by the adoption of the resolution by the member states, the 76th World Health Assembly, and that encouraged governments and the private sector to invest in strengthening laboratory infrastructure, supply chain management, workforce and capacity building, and diagnostic quality assurance programs. This event will bring together some very smart policymakers, global health experts, and industry leaders to assess the connections between strategic investments in diagnostics and the successful realization of the SDGs. It's going to be a really interesting discussion. I hope you're looking forward to it, as am I. The next hour and a half that we're going to ask you to focus on this before we get back to drinks, we're going to explore the intersections among diagnostics and universal health coverage, global health security, and pandemic preparedness, as well as the impact of access to quality diagnostics on global health systems beyond the 2030 deadline for the SDGs. So we'll take questions in this program. You will see the QR code on the handout at your chair. We like to vet those, if that's okay, to make sure all those questions have question marks at the end of them. So if you have a question, submit it via that QR code, and we'll get around to it. And then please stick around and join us for the reception afterwards. We'll have a few snacks, a few drinks, and an opportunity to network and get to know each other a little better. So why don't we get going? Is everyone ready? Wonderful, let's do it. So I'd now like to introduce our first panel and ask them to join us in order. Dr. Hatem Amer, Associate Minister of Health, Higher Education and Scientific Research of Egypt. Welcome, Hatem. Thank you, Dr. Amer. Dr. Ayoade Alakija, Special Envoy to the Access to COVID-19 Tools Accelerator, the ACT-Accelerator, WHO Chair of the Board, Foundation for Innovative New Diagnostics, or FIND. Thank you, Dr. Alakija. Ethel, Leonor, Noia, Maciel, Secretary for Health Surveillance and Environment, the Ministry of Health of Brazil. Dr. Maciel, thank you so much. And His Excellency Ong Ye Kung, Minister of Health for Singapore. Dr. Ong, thank you so much. Please, everyone, be seated. I'll be right here. Thank you all for joining us on this discussion. We've got a wide range of geographies and interests, and I'm really looking forward to this talk, and we have a little time to get through it. So, Dr. Alakija, I'd like to start with you, if I might. The ACT-Accelerator really helped bridge the pandemic and the disparities between nations in accessing crucial tools. What lessons can we draw from the ACT-Accelerator? I was just talking about testing at home a few seconds ago. Would love to hear your learnings.
Well, thank you very much, and it's a real honor to be here with you all. We're from a wide range of geographies, as you said, but we're all interconnected. So it's a real delight to be here with, the Honorable Minister from Singapore, with my Brazilian sister, because I have an Afro-Brazilian husband, and my new Egyptian brother. So, it's a family meeting. ACT-Accelerator, there were pluses and there were minuses, and I don't think that we can say that it was a complete success in that we didn't completely bridge that gap in both in diagnostics, vaccines, or in therapeutics, and there's still countries that have been left behind. However, the counterfactual of that is that without the ACT-Accelerator, we would have lost millions more people, and so it was desperately needed. It was an experiment. It was put together very quickly, and it got us the tools that we needed. When it comes to diagnostics specifically, I'm going to start with diagnostics, because diagnostics often seen as a bridesmaid, and you sort of go everywhere, everyone's all talking about vaccines, but if you don't talk about diagnostics are the bedrock of a health system. You just said that your wife wasn't very well. If you hadn't had access to those diagnostics, well, you wouldn't be here today. And also you wouldn't be able to treat. And so I think what the lessons that we're not learning coming out of COVID is that we're focusing in on certain sectors. We're focusing in on vaccines. I mean, the whole world's talking about boosters right now, and certain countries and geographies that some people have had their 5th. How many of you have had 5 in this room? There you go. I mean, how many have had more than 5? Well, there you go. Wow. And in some countries of the world, in my country, Nigeria, for instance, most people haven't even had 1 vaccine. But because of that, they also we don't have diagnostics. A diagnostic test in Nigeria throughout COVID was about $100 to $150. So the lessons coming out of something like the ACT-Accelerator is that, number one, we have to involve those at the grassroots from the very beginning, those who understand. I say often, and I speak Yoruba, which is my language, which means that the person who wears the shoe is the one who knows where it's pinching and where it hurts. Now, these are pinching right now because I've been wearing them all day, but I'm the only one who can tell you that. You over there, you're looking at them, you're thinking they're cute, right? But they're painful. They're painful. So if you don't involve me in that discussion, you won't understand how to help me, how to help my health system. And so diagnostics really are about the bedrock of primary health care, of prevention. ACT-Accelerator, to my mind, focused too much on vaccines at the expense of diagnostics. And, those are the shiny objects, so the things with money. So that would be my first, really my first core lesson, is that we were very siloed in many ways. We left the low middle income countries of the world behind, and we are still leaving them behind.
Understood. Well, thank you for sharing that. And Dr. Ong, Minister Ong, perhaps we could come to you now and talk a little bit about Singapore, a lauded healthcare system. I'm sure with diagnostics galore, you endured a pandemic prior to COVID, the SARS pandemic, and I'm wondering if that's a lesson that you learned then as well, the importance of diagnostics. If you could tell us a little bit about the lessons learned from SARS when it comes to diagnostics.
Okay. First of all, I should say there's a perk of being health minister. You get mistaken to be a doctor. So I'm not Dr. Ong. I
take it back. Minister Ong.
We had SARS in 2003. At that time, there was no genome sequencing, and there was no test kits. So SARS was more deadly than COVID, but fortunately not as transmissible. So at that time, we resort to using the diagnostic that we use was a thermometer. Yeah. And if you arrive in Singapore, there's a remote thermometer that takes your temperature, and that was the only way. But with that rudimentary method, it forms the foundation for us to trace, quarantine those, diagnose those who are with SARS, and then contact trace all those who have come into contact with them. And then through that operation done over several months, we took control of the situation, and SARS slowly went away. Yeah. But I think if we had just a thermometer to test for COVID, first it's the wrong diagnostic because you are transmissible before you get fever. And secondly, it's just too much error rate. Fortunately, by the time we have COVID, which is far more transmissible, we already have genome sequencing, we have COVID test kits. And it forms the foundation, again, of our contact tracing and quarantine operation, which went on for several months, and we held on until vaccines were available. So I think I agree with what Dr. Alakija said, that people mistakenly think that diagnostic is the bridesmaid. Actually, it's not. It's probably the parents-in-law, without whom you wouldn't even have a bride and a groom to start with. So everything we do in healthcare, it starts with diagnostic. Yeah, from not just pandemic. In the beginning of pandemic, I mentioned that was the basis for contact tracing and for keeping things under control. As you get vaccines, as the pandemic progresses, you use it to understand where are you on the epidemic curve. You use it to monitor different strains that are evolving and how are they responding to vaccines and other countermeasures. And beyond the pandemic, you use diagnostics for a range of things. We talk about population health now, keeping ourselves healthy, keeping NCDs away, managing that. All this require diagnostics. It is the foundation. And I think the fear and the worry I have today, alluded to by Ayoade as well, is that we put so much focus on vaccines, where to manufacture, self-sufficiency, but actually pay a bit more attention to the basics. The parent-in-laws cannot be forgotten. We're just paying too much attention to vaccines.
I like working that metaphor. Perhaps you could talk about your shoes or some examples how painful they are when we talk next. They look very comfortable, by the way.
And they are comfortable.
They look very comfortable. We'll get back to that. Secretary Maciel, one of the things that's key in running diagnostics and ensuring that populations believe in the results is that kind of social contract and trust in what science is telling us. Mm-hmm. I know that there has been a different experience in Brazil through COVID. Mm-hmm. And without kind of pushing and getting into politics at all, I would just love to hear, and I think it would be very interesting to hear the story of what you experienced in Brazil when it came to diagnostics as well.
Wow. Andrew, this is a very sad history. It's very sad. The last 4 years in Brazil, I think everyone in this room maybe has some idea. We have this misinformation about diagnoses and treatments and vaccines and all that we have available for COVID-19. But take this lesson, and with this new government that we are starting right in this 8 months right now, I think one very important topic that make us wake up in the night, it's make every Brazilian, it's a country with more than 2 million inhabitants, have the same diagnosis that you have in your home. Mm-hmm. So talk about access, it's crucial for us, and make the diagnostics affordable for everyone, and especially in a vulnerable population, because Brazil, as other countries, we have vulnerable populations, different between one part of the region in the country and another part, and even in the same state, we have a very different inequalities in access to diagnostics and the tools that we have already. So talking about innovation and have right now the innovation that is already available, I think access is our biggest challenge right now, especially in indigenous population, migrants that became a problem in Brazil right now. We didn't have this issue in Brazil. We didn't know how to deal with this about our health policy, as we have a universal health system. So we all are diagnostics and therapeutics are free of charge for Brazilian and non-Brazilian. And this is a challenge because especially indigenous people between the Amazonia region for our border, we are facing this mobility between indigenous people with a lot of different languages that our health system are not prepared to deal. So access and have the government have to the guarantee to give all these diagnostics that we have already and those that we are think that we will have for everybody, for a lot of disease at home. Will be the access and affordable price will be our big challenge for this new government.
Very interesting in thinking about the indigenous populations as well as in a completely different ballgame of how you are relating to them and their belief sets as well. That's fascinating to think about. Dr. Amer, it'd be great to bring, you are a doctor, that's correct? Yes. Just making sure. Associate Minister of Health as well. To bring you into the conversation, a big success story in Egypt is the 100 Million Healthy Lives campaign, which basically eradicated hepatitis C. Would imagine key lessons learned about scaling up and streamlining diagnoses to execute on that. Could you tell us a little bit about that experience?
Of course. Well, first of all, it's a tremendous pleasure to be here with everyone. The minister was supposed to be here, and he got pulled away, so I get the chance to be with you today, which is wonderful.
We are fortunate.
Thank you. So in 2018, Egypt decided to put an end to hepatitis C because we had the most prevalence of hepatitis in the world. And that wouldn't have been possible without mass screening, because people would be carriers and they would have hepatitis and they would be infected, but they wouldn't know. So the campaign began in the second half of 2018, and within a duration of a little over 9 months, we were able to screen a little under 65 million people. 65 million Egyptians and also residents in Egypt. The population of Egypt is a little over 105 million, and we have over 9 million refugees and migrants in the country. So the mass screening was done in over 7,000 testing centers in 27 governorates, which is the entire republic.
In what time frame?
A little over 9 months.
Wow, that's incredible.
Yeah. And once we screened those 65 million people, we had around 1.2 million that were vector positive for HCV. And then we started treatment right away. And during that campaign, we didn't just screen for hepatitis, but also for non-communicable diseases like diabetes and hypertension, obesity. So we have a huge amount of data now that could be used to target population with campaigns for education, for prevention, and for treatment, of course. And that was just the beginning. So after the 100 Million Healthy Lives campaign, which targeted hepatitis at the beginning, we started to roll out early detection of breast cancer, early detection of prostate, of colorectal cancer. And as we speak now, we are about to conclude another campaign that also aims to early detection of diseases. And we've seen the ROI on the hepatitis campaign. Exactly. 350+% return on investment when you screened all those people. And the thing is, it was also not done by the Ministry of Health on its own. It was a multi-sectoral campaign. You had several ministries involved. You had WHO, you had UNAIDS, you had several UN organizations, as well as the World Bank. So it was a huge campaign, and everyone was involved.
Wow.
Now we know why the minister sent you. That was very good. So, and I noticed that Dr. Alakija really locked into your ROI statement. So maybe we could talk a little bit before we go off of you. How did you get to that ROI number? Tell us about the economics.
They were, I don't have the exact details.
As much as you can.
Yeah, but based on the cost of screening and based on the treatment expense that we had found out earlier, when you would detect them further on after they're infected with the disease, the cost of treatment is a lot more expensive than early detection and prevention. So even though it was a huge campaign, it cost us hundreds of millions of dollars, and Egypt is not a very rich country. So, but when that was done and when that investment was put in, it showed that it does save the country hundreds of millions of dollars on the long run.
Dr. Alakija, I know this is a hot button for you, the power, the economic power of diagnostics.
Well, I think we could just leave right now. I mean, that was just excellent. The ROI, I mean, the minister and I had this conversation on the way here, and we've just finished speaking at the high-level meeting, and and I was speaking on finances on the panel on PPPR, and talking about the fact that the world needs to start seeing health as an investment, but also to dive into diagnostics and screening. I mean, I need those notes because this is the exact point. If we invest in diagnostics, if we invest in screening, let me use COVID again as an example. You know, we focused in on therapeutics, we focused in on vaccines. My country, Nigeria, there was not a rapid test available. You just couldn't get them. It was all PCR. So, you know, who has $100 to have a test every time you have a scratchy throat? It became a tool for the wealthy and the privileged who wanted to travel, really, was the only time you got a test. So think what that does in terms of disease progression. Think about what that did to people. I mean, we can get into long COVID as well, of those who were never diagnosed in many of the low-income countries of the world who are now suffering from something that they were never diagnosed with, so they don't know why they're suffering. They don't understand why they're unable to function to their full economic, you know, sort of potential. So it works both ways. You save the country money. There's a huge upfront investment, of course, in you know, investing in the diagnostics and the kits and the screening, the surveillance program. But at the long term, you save money not just in tertiary care or in treatments going forward, but you also are investing in your economy because you have a healthy population. You have healthy people, and you know, you also have people who are confident about their health. I will use myself as an example. I've had the last 3 months, I've been really quite unwell with I had malaria, and then I had something else, and I had to go and have several, you know, tests. You know, and until I had done a full screen of tests, I realized that subconsciously I was almost limping. I was, you know, almost afraid to do certain things. But being able to go and get a full battery of tests and get my results, screening back, and realize that, okay, I can go like I did in Central Park on Sunday. I can go sprinting now. You know,
different shoes.
It make different shoes, Andrew. You know, but it lifts a population. Yeah. Diagnostics are absolutely the bedrock of everything we should be doing in health. We're talking about UHC, we're talking about PHC, we're talking TB, we're talking pandemic preparedness. If we don't have point of care tests in various facilities at the very, very lowest level of the community, then we're unable to protect our populations. And therefore, we are building up that economic downturn further down the road. It is an investment, not a drain on resources.
We need a finance ministers panel here tonight, I think. We've got great ministers, we need more ministers. Your Excellency, Minister Ong, maybe you could tell us a little bit, with your diverse experience in the public and private sector, how can we, there's still cost to this, even though there's this huge ROI. You know, we were just hearing about Egypt's experience. Tell us how we might be able to enfranchise the private sector to help in this diagnostics fight. It happened with COVID. How can we do it and standardize it and make it?
The private sector is natural, like Roche, naturally incentivized to help out because they produce products and there's value, and it will be aligned with their commercial interest. But I would say the concept that healthcare is an investment, it should be a bit nuanced. Because when we are sick and we have to go to hospital, we incur a huge bill. It's difficult to say that's an investment because it is at best a repair job. And often when you are sick, you are not repaired or restored to your original health, right? It's an imperfect repair job, and I wouldn't consider that an investment. In fact, you want to make as few people sick as possible. So that comes to population health, which diagnostics have a big role to play.
Right.
And I think that is, and where you build health outside of hospital, in the community, at home, that is where there is an ROI. That is where I think we can justifiably say that healthcare can be an investment. In this aspect, in Asia, maybe I talk about Asia.
Please.
Is as the biggest social phenomenon happening in Asia, in many Asian countries, is that we are aging rapidly. Europe is probably the first continent that started to age, and some countries are already super aged. I think the next continent will be Asia, and I think by 2030, 60% of seniors in the world will be living in Asia. In Singapore, we are now about 17% aged. That means 65 and above. By 2026, we will hit 21%. By 2030, 25%. So for us to handle the disease burden of an aging population, actually we can't handle. The healthcare system will be under so much pressure. The only way for us to be able to handle and manage that is to keep the population healthy. And that has to be done outside of hospitals, in communities, at home. Government having policies to support individuals to self-care, community to support care. And whether it's self-care or community supporting care, that has to be done. The first foundation, you go back to diagnostics. When we take care of our own health, you measure your own blood pressure, you go to the doctor, take your blood sugar, find out your lipids level, or it must start from that level. And then you can find that with good diagnostics, I can take charge of my own health and do simple, cost-effective things like exercise, diet, cut down salt, sugar, fat, sleep better, wear more comfortable shoes. And
You did it.
oh, you caught that. No, you strike that out. So these are things that I think are truly an investment in health.
Excellent. Well said. This is a fascinating conversation. Secretary Maciel, I'm sorry, I keep going back to politics and geopolitics. Brazil is taking on the lead on the G20 next year. How big, there's a little momentum we have here, say a little, that we want to push on. How important and how will diagnostics feature in Brazil's G20 presidency?
It will be very important because we are, since 1988, investing in primary health care and diagnostics and building our local production and work in collaboration with private sector because the government in Brazil is the biggest, how do you say, buyer from the private sector. The bill is gigantic in Brazil for to have all this health for the 200 million people. So, but for the G20, the priority of the President Lula is fight against inequality, and inequality in diagnosis and access to diagnosis is one biggest issue right now, because without diagnostics we cannot have the early treatment and all so on. And in Brazil, we have this we have the infectious disease, the non-transmission disease, and the violence and accidents together. So have this diagnosis as a point of care. It will be the challenge for us, especially in this difficult, vulnerable population, but with very difficult to access, like in Amazonia region, which is like a large region in Brazil, with more than 300 different tribals and indigenous population, and speaking different languages, so and with different culture, because sometimes for some indigenous in Brazil, if you get some sample for them, you need to give them back the sample. You cannot take the sample.
It's still part of them.
So it's because it's a culture thing. You cannot take this. You have to give them back. And as linked with your first question, building this trust with the health system that will do this. I'll give your hair or your blood to you again, because when they die, they need to take everything that belong to them. So this is a part of culture of one of these indigenous peoples. So it's very complex.
Yes, clearly.
It's very complex. But for the G20, this will be a good point.
And Dr. Amir, to come back to you, you have now in Egypt launched the first integrated laboratory for pathological and genetic analysis. We were just talking about equity, basically, the diagnostics, the big equalizer. How does this fit into your vision for healthcare and diagnostics in Egypt? And is this born from the lesson learned from the fantastic hepatitis C story you were just telling us earlier, the 100 Million Healthy Lives campaign.
Yes, it is. It is building on that campaign, and it's a huge lab that will have over 2,000 different tests to be done on everyone, and equity is one of the most important things for us. And again, it's not just for Egyptians, but for everyone on Egyptian land, whether refugees, migrants, and whether they're documented or not. Because one of the things that we are very, very proud of in Egypt is that we do not have migrants and refugees in camps separated. They're integrated within the community, and they have equitable access to healthcare just like Egyptians. And it is something that that we want to build on.
Wonderful. The clock is winding down. I wanted to go back to Dr. Alakija for one moment. And I'd like to end on a positive note, but I have to ask you this one question. We talked about this earlier. Have we learned the diagnostics lesson with everything that we've been through and all the great work that you're talking about?
No, we haven't, not as a global community, but I think we can. I think we can. I think conversations like this are absolutely critical. It's wonderful to learn from the experience of Egypt on the surveillance, the ROI. I think we need to start looking at, as I've said before, what the world understands is money. You know, I said at the HLM at the UN earlier that money is power, and you know, and what the world understands is what brings finances. But when you talked about that panel of ministers, finance ministers, I absolutely agree with you there, because you really need to bring those who have control of the purse to the table. And when they begin to understand that, oh, you mean I won't have to give you this much for your tertiary budget if I invest this much in diagnostics? Give me the paper, let me sign it now. You know, when they start to hear examples from places like Egypt, I think the world begins to recognize that preventative care, population health is really, prevention is better than cure, you know, catching it early, making sure we have healthy populations. That is where the core of health systems and our core humanity is. So no, we didn't learn the lessons because we're not funding that at the moment, but perhaps we're not framing it properly. We're not helping policymakers to understand exactly what that ROI is.
Well, thank you for that, and it really does underscore all of the lessons that you've told us from your various countries. Aging populations in Singapore, the only way to manage that will be through healthy populations, keeping the population healthy, and diagnostics in advance of that. How to deal with equity across the Amazon and indigenous populations. I can't even imagine what a challenge, but an opportunity with the G20 presidency. And the exemplary story of Egypt. What a fantastic example for all of us to look towards. And Dr. Alakija, what we've learned from the ACT-Accelerator, what we have yet to do, it's all about the money. And we have to come back to that. But I've learned a tremendous amount from this discussion. I want you to join me in thanking the ministers and doctors for their good work. Thank you.